Question 1. System analysis indicates a patient has arrived at the emergency department in critical condition and is unable to communicate. A law enforcement officer requests access to the patient's medical record, stating the information is vital to identify the patient and potentially locate next of kin, who may have crucial medical history relevant to the patient's current emergency. The accredited record technician is aware of the patient's identity, but has not yet obtained explicit consent for information release from the patient or a legally authorized representative. Option A. Refuse to provide any information to the law enforcement officer, citing patient confidentiality, and inform them that information can only be released with a court order or patient authorization. Option B. Immediately provide the patient's complete medical record to the law enforcement officer, as the information is requested for an emergency situation. Option C. Release only the patient's name and date of birth to the law enforcement officer, as this is the minimum necessary information to identify the patient. Option D. Attempt to contact the patient's designated emergency contact or a legally authorized representative to obtain consent for the release of necessary information, and if unsuccessful, consult with legal counsel regarding potential emergency disclosure exceptions under HIPAA. The correct answer is D. Attempt to contact the patient's designated emergency contact or a legally authorized representative to obtain consent for the release of necessary information, and if unsuccessful, consult with legal counsel regarding potential emergency disclosure exceptions under HIPAA. Explanation. This scenario is professionally challenging because it pits the immediate need for information to potentially save a life against the fundamental right to patient privacy and confidentiality, as mandated by the Health Insurance Portability and Accountability Act, HIPAA, in the United States. The accredited record technician, ART, must navigate these competing ethical and legal imperatives without direct physician authorization, which is the standard protocol for releasing protected health information. 5. The correct approach, which involves attempting to contact the patient's designated emergency contact or seeking a court order or patient authorization, represents best professional practice because it upholds the core ethical principles of patient autonomy and confidentiality, while still exploring avenues to obtain the necessary information legally and ethically. HIPAA privacy rule permits disclosures for certain emergency situations, but these are narrowly defined and often require subsequent notification to the patient. Directly releasing PHI without a clear, documented exception or authorization, even in an emergency, carries significant legal and ethical risks. An incorrect approach would be to immediately release the patient's PHI to the emergency responder without any attempt to verify the emergency or obtain authorization. This directly violates HIPAA requirements for safeguarding PHI and the principle of patient consent. Releasing information without proper authorization, even with good intentions, can lead to severe penalties, including fines and reputational damage, and erodes patient trust. Another incorrect approach would be to refuse to provide any information, even if it means potentially hindering life-saving efforts, without first exploring all permissible avenues for disclosure. While prioritizing privacy is crucial, a complete refusal without considering emergency exceptions or alternative authorization methods could be seen as a failure to act responsibly in a critical situation, though less severe than an outright unauthorized disclosure. Professionals should employ a decision-making framework that prioritizes legal compliance and ethical integrity. This involves 1. Identifying the core conflict, patient privacy versus potential life-saving intervention. 2. Consulting relevant regulations and organizational policies, in this case, HIPAA and internal protocols for emergency disclosures. 3. Exploring permissible exceptions, understanding when and how PHI can be disclosed in emergencies. 4. Seeking authorization, attempting to obtain patient consent or authorization from a legal representative. 5. Documenting all actions and decisions, maintaining a clear record of the situation, the steps taken, and the rationale behind the final decision. If immediate disclosure is deemed absolutely necessary and no other option is available, it should be done with extreme caution, limited to the minimum necessary information, and followed by immediate documentation and notification to the appropriate parties. Question 2. During the evaluation of a patient's electronic health record, an accredited record technician, ART, notices that a physician's progress note contains a factual inaccuracy regarding a medication dosage administered. The note was electronically signed by the physician yesterday. The ART is aware that the correct dosage was administered based on other documented evidence within the record. What is the most appropriate course of action for the ART? Option A. Create a new entry in the record stating the correct medication dosage without notifying the physician of the original error. Option B. Directly edit the physician's progress note to reflect the correct medication dosage, as the ART has verified the accurate information. Option C. Contact the physician who authored the note to inform them of the discrepancy and request an amendment or addendum to the record. Option D. Ignore the discrepancy, assuming the physician will notice and correct it later, as the ART is not responsible for clinical accuracy. The correct answer is C. Contact the physician who authored the note to inform them of the discrepancy and request an amendment or addendum to the record. Explanation. The scenario presents a common challenge for accredited record technicians' art, involving the integrity and completeness of health record documentation, specifically concerning a physician's progress note. The core professional challenge lies in balancing the need for accurate and timely record keeping with the ethical and regulatory obligations to both the patient and the healthcare provider. The ART must exercise careful judgment to ensure the record reflects the patient's care accurately without altering or adding information that could misrepresent the clinical encounter or violate professional standards. The correct approach represents best professional practice because it adheres strictly to established health record documentation standards, likely governed by regulations such as HIPAA in the U.S., which mandate accuracy, completeness, and timeliness. By identifying the discrepancy and initiating the established protocol for correction, contacting the physician for clarification and amendment, the ART upholds the principle of record integrity. This process ensures that any modifications are authorized, documented, and traceable, maintaining the legal and clinical defensibility of the health record. This aligns with the ART's role as a custodian of health information, responsible for its accuracy and security. An incorrect approach of directly editing the note without physician authorization would be a significant regulatory and ethical failure. This action constitutes unauthorized alteration of a legal document, potentially violating HIPAA privacy rule and security rule by compromising the integrity of protected health information. Also breaches professional ethics by misrepresenting the physician's original documentation, which could lead to incorrect clinical decisions, patient harm, and legal repercussions for the healthcare facility and the ART. Another incorrect approach, such as ignoring the discrepancy, fails to meet the standard of care for record management. This inaction allows an inaccurate record to persist, undermining its reliability for continuity of care, billing, and legal purposes, and potentially violating facility policies and regulatory requirements for accurate documentation. Finally, fabricating an entry to correct the record is a severe ethical and legal violation, constituting fraud and misrepresentation of patient care. Professionals should employ a decision-making framework that prioritizes adherence to established policies and procedures, regulatory compliance, and ethical conduct. This involves 1. Identifying the issue and its potential impact. 2. Consulting relevant policies, procedures, and regulations, e.g., facility policies on record amendment, HIPAA guidelines. 3. Communicating with the appropriate parties, in this case, the physician, to seek clarification and authorize correction. 4. Documenting all actions taken and communications. 5. Escalating the issue if resolution cannot be achieved through standard channels. This systematic approach ensures that decisions are informed, defensible, and aligned with professional responsibilities. Question 3. The risk matrix shows a moderate likelihood of unauthorized access to patient demographic and clinical information within the electronic health record, AIR system, due to insufficient granular access controls and infrequent review of audit trails. Which of the following strategies best addresses these identified risks while maintaining efficient patient care delivery? Option A. Restrict all user access to patient demographic and clinical information to a single designated HIM department until a comprehensive system-wide security overhaul can be completed. Option B. Deploy advanced data encryption across the entire EHR system without modifying current user access permissions or audit trail review procedures. Option C. Implement role-based access controls for all EHR users. Enforce the minimum necessary access principle and establish a schedule for regular, detailed review of EHR audit trails with a defined process for investigating discrepancies. Option D. Conduct an annual comprehensive security audit of the EHR system and rely on external IT consultants to address any identified vulnerabilities. The correct answer is C. Implement role-based access controls for all EHR users, enforce the minimum necessary access principle, and establish a schedule for regular, detailed review of EHR audit trails with a defined process for investigating discrepancies. Explanation: this scenario presents a common challenge in health information management, HIM, where the need to balance data accessibility for patient care with the imperative of patient privacy and data security is paramount. The risk matrix highlights potential vulnerabilities in the electronic health record (EHR) system, specifically concerning unauthorized access to patient demographic and clinical information. The professional challenge lies in implementing effective controls that mitigate these risks without unduly hindering legitimate access for authorized healthcare providers. The correct approach, which involves a multifaceted strategy of enhanced access controls, regular audit trail reviews, and comprehensive staff training, represents best professional practice because it directly addresses the identified risks in a systematic and compliant manner. This approach aligns with the core principles of HIM, emphasizing data integrity, confidentiality, and availability. Specifically, it adheres to the Health Insurance Portability and Accountability Act, HIPAA, privacy and security rules, which mandate the implementation of administrative, physical, and technical safeguards to protect electronic protected health information, E5. Enhanced access controls, such as role-based access and minimum necessary principles, ensure that only authorized individuals can access specific data. Regular audit trail reviews are crucial for detecting and investigating any potential breaches or misuse of information, fulfilling the HIPAA requirement for monitoring system activity. Comprehensive staff training reinforces awareness of privacy policies and security procedures, a key administrative safeguard. An incorrect approach that focuses solely on restricting all access to patient records would be professionally unacceptable. This failure stems from a misunderstanding of the minimum necessary principle under HIPAA. While privacy is critical, patient care requires timely and appropriate access to health information by authorized providers. Overly restrictive measures would impede this access, potentially compromising patient safety and quality of care, and thus failing to meet the operational needs of the healthcare facility. Another incorrect approach, which might involve implementing advanced encryption without addressing user access or audit trails, is also professionally flawed. Encryption is a vital technical safeguard, but it is only one component of a comprehensive security program. Without robust access controls and monitoring, encrypted data could still be accessed inappropriately if credentials are compromised or if internal misuse occurs. This approach neglects the administrative and technical safeguards required by HIPAA for a holistic security posture. Finally, an approach that relies solely on periodic, high-level security assessments without implementing ongoing monitoring and corrective actions is insufficient. While assessments are valuable, they provide a snapshot in time. The dynamic nature of cyber threats and internal user behavior necessitates continuous vigilance. Failing to implement ongoing monitoring and response mechanisms leaves the organization vulnerable to evolving risks and potential breaches between assessment periods, violating the spirit and letter of HIPAA security requirements for ongoing risk management. The professional decision-making process for similar situations should involve a thorough risk assessment, identification of specific vulnerabilities, and the development of a layered security strategy that incorporates administrative, physical, and technical safeguards. This strategy must be aligned with regulatory requirements, such as HIPAA, and should prioritize patient safety and quality of care alongside data protection. Regular review and adaptation of security measures based on audit findings, incident reports, and evolving threat landscapes are essential for maintaining a secure and compliant health information environment. Question 4. The control framework reveals several instances where the assigned ICD-10-CM and CPT codes for a recent batch of patient encounters do not precisely align with the documented diagnoses and procedures. These discrepancies appear to be minor, affecting only a few characters in the ICD-10-CM codes and the specificity of the CPT codes. What is the most appropriate course of action for an accredited record technician to take in this situation? Option A. Overlook the discrepancies, assuming they are minor and unlikely to impact billing significantly, to maintain current productivity levels. Option B. Systematically review each identified discrepancy by cross-referencing the documentation with the official ICD-10-CM and CPT coding manuals, as well as any relevant payer policies, to determine the correct coding and document the findings. Option C. Assume the discrepancies are a temporary system glitch and await further instructions or system updates before taking any action. Option D. Immediately escalate the issue to management, without attempting to verify the accuracy of the coding against established guidelines. The correct answer is B. Systematically review each identified discrepancy by cross-referencing the documentation with the official ICD-10-CM and CPT coding manuals, as well as any relevant payer policies, to determine the correct coding and document the findings. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare record management, identifying and rectifying coding inaccuracies that could lead to improper billing and potential regulatory violations. The professional challenge lies in balancing the need for accurate data with the operational demands of a busy coding department. A coder must not only possess technical coding skills, but also the critical thinking to recognize deviations from established guidelines and the ethical responsibility to report them, even if it means additional work or potential friction with colleagues. Pressure to maintain productivity can sometimes create an environment where minor errors are overlooked, making a proactive risk assessment approach crucial. Correct approach analysis. The correct approach involves a systematic review of the identified coding discrepancies against the relevant coding guidelines and payer policies. This aligns with the core responsibilities of an accredited record technician, ART, as defined by professional standards and regulatory expectations. Specifically, it reflects the ART's duty to ensure the accuracy and integrity of medical records and associated billing data. By cross-referencing the identified errors with official coding manuals, e.g., ICD-10-CM, CPT, and payer-specific rules, the ART can definitively determine if the coding is compliant. This methodical approach minimizes subjective interpretation and provides objective evidence for any necessary corrections or appeals. It upholds the principle of accurate representation of patient services, which is fundamental to both patient care and financial integrity. This process is directly supported by the ethical codes that govern ARTs, emphasizing accuracy, integrity, and adherence to professional standards. Incorrect approaches analysis. Ignoring the discrepancies because they appear minor is a significant regulatory and ethical failure. It violates the ART's responsibility to maintain accurate records and can lead to systemic under- or overbilling, which are fraudulent. This approach prioritizes expediency over compliance, a direct contravention of professional ethics and potentially illegal. Assuming the discrepancies are due to a temporary system glitch without verification is also professionally unacceptable. While system issues can occur, a responsible ART must investigate the root cause. This assumption bypasses the necessary audit process and could mask underlying coding training needs or persistent system problems, leading to continued noncompliance. Immediately escalating the issue to management without attempting to verify the discrepancies against coding guidelines demonstrates a lack of independent problem solving and an abdication of the ART's direct responsibility. While escalation is sometimes necessary, it should follow a preliminary assessment. This approach fails to leverage the ART's expertise and can overburden management with issues that could be resolved at the technician level, potentially indicating a lack of confidence in their own abilities or a misunderstanding of their role in the quality assurance process. Professional reasoning. Professionals in this role should employ a structured decision-making process that begins with understanding the nature of the discrepancy. This involves 1. Identifying the specific coding element in question. 2. Consulting authoritative coding resources, e.g., ICD-10-CM CPT official coding guidelines to determine the correct application. 3. Reviewing payer-specific policies if applicable, as these can influence coding requirements. 4. Documenting the findings, including the rationale for any proposed changes. 5. If the discrepancies are confirmed and significant, initiating the appropriate correction process and considering the need for further education or process improvement. This systematic approach ensures that decisions are evidence-based, compliant, and ethically sound, protecting both the organization and the integrity of patient records. Question 5. Regulatory review indicates that accredited record technicians are responsible for ensuring the accuracy and completeness of patient health information, When gathering data for a new patient record, which of the following approaches best adheres to regulatory requirements and professional best practices for data collection? Option A. Conducting structured interviews with the patient using validated questionnaires and cross-referencing the collected information with existing, verified electronic health records. Option B. Collecting demographic data exclusively from publicly accessible online databases and social media profiles. Option C. Relying primarily on informal discussions with nurses and administrative staff who have interacted with the patient. Option D. Accepting all information provided by the patient without any independent verification or cross-referencing with other sources. Correct answer is A. Conducting structured interviews with the patient using validated questionnaires and cross-referencing the collected information with existing, verified electronic health records. Explanation. Scenario analysis. This scenario presents a common challenge for accredited record technicians, ART, in ensuring the integrity and accuracy of patient data. The core difficulty lies in balancing the need for comprehensive data collection with the practical limitations of time, resources, and the potential for data degradation or misinterpretation when relying on multiple, disparate sources. An ART must exercise careful judgment to select methods that are both efficient and compliant with regulatory standards for data quality and patient privacy. Correct approach analysis. The correct approach prioritizes the use of established, validated data collection instruments and direct patient interaction. This aligns with best practices for data integrity and accuracy, as outlined in regulatory frameworks governing health records. Direct patient interviews, when conducted using standardized questionnaires or structured interview protocols, provide the most reliable and contextually rich data. Cross-referencing this information with existing, verified electronic health records, AER, offers a robust method for validation and completeness. This dual approach minimizes the risk of introducing errors from less reliable sources and ensures that the collected data is both accurate and relevant to patient care, adhering to principles of data quality and patient confidentiality mandated by regulations. Incorrect approaches analysis. Relying solely on informal conversations with ancillary staff introduces a significant risk of anecdotal evidence and potential bias, which is not a compliant data collection method for official patient records. This approach lacks the rigor and standardization required by regulatory bodies, potentially leading to inaccurate or incomplete data. Utilizing only publicly available demographic data from external databases, without direct patient verification or correlation with clinical information, is insufficient for comprehensive patient record management. Such data may be outdated, incomplete, or not specific to the individual's current health status, failing to meet regulatory requirements for accurate and up-to-date patient information. Accepting patient-provided information without any form of verification or cross-referencing, especially if it contradicts existing records or appears incomplete, poses a risk to data integrity. While patient input is crucial, regulatory guidelines emphasize the need for validated and authenticated data within the official record. This approach could lead to the inclusion of erroneous or misleading information. Professional reasoning. ARTs should adopt a systematic approach to data collection, beginning with the most reliable sources and employing validation techniques. This involves understanding the specific regulatory requirements for data accuracy, completeness, and security applicable to their jurisdiction. When faced with multiple potential data sources, professionals should evaluate each based on its reliability, validity, and compliance with established protocols. Prioritizing direct patient engagement and validated EHR data, followed by cross-referencing, forms a strong foundation for accurate record-keeping. Any deviation from these principles should be carefully considered against regulatory mandates and ethical obligations to ensure patient safety and data integrity. Question 6. System analysis indicates that an accredited record technician, ART, receives a request from a third party for a patient's complete medical record, citing a vague need for personal review. The ART is aware that the patient has expressed concerns about this individual in the past. Following the regulatory framework for health information, what is the most appropriate course of action for the ART? Option A. Refuse to release any information to the third party, citing patient privacy concerns without further investigation. Option B. Release only the demographic information and dates of service, as this is generally considered less sensitive. Option C. Verify the requester's identity and the patient's authorization for release, and if authorized, proceed with the release of the record. If authorization is not present or unclear, consult with the patient or their legal representative and the facility's privacy officer before taking any further action. Option D. Immediately release the complete medical record to the third party, assuming they have a legitimate reason for the personal review. Correct answer is C. Verify the requester's identity and the patient's authorization for release, and if authorized, proceed with the release of the record. If authorization is not present or unclear, consult with the patient or their legal representative and the facility's privacy officer before taking any further action. Explanation. Scenario analysis. This scenario presents a common yet complex ethical and legal challenge for an accredited record technician (ART). The core conflict lies between a patient's right to privacy and access to their health information, and the potential for that information to be used in a way that could cause harm or violate other legal statutes. The ART must navigate these competing interests while adhering strictly to the governing regulatory framework for health information management. The challenge is amplified by the sensitive nature of the information and the potential for misinterpretation or misuse. Correct approach analysis. The correct approach prioritizes patient rights and legal compliance by seeking clarification and adhering to established protocols for information release. This aligns with the fundamental principles of health information management, which emphasize patient confidentiality, data integrity, and adherence to legal mandates. Specifically, it upholds the patient's right to access their records and ensures that any release of information is done through authorized channels and with appropriate consent or legal justification. This approach demonstrates a commitment to ethical practice by avoiding unauthorized disclosure and respecting the patient's autonomy. Incorrect approaches analysis. One incorrect approach involves directly releasing the information without further inquiry. This is a significant regulatory and ethical failure because it bypasses established procedures for verifying the legitimacy of the request and ensuring proper authorization. It could lead to a breach of patient confidentiality, violating privacy laws and potentially exposing the patient to harm. Another incorrect approach is to refuse the request outright without understanding the context or legal basis for the request. This fails to uphold the patient's right to access their information, which is a cornerstone of health information management regulations. It also demonstrates a lack of professional judgment and a failure to explore legitimate avenues for information release. A third incorrect approach is to release only a portion of the requested information based on an assumption about the requester's intent. This is problematic as it involves making subjective judgments about what information is appropriate to release, which is not the ART's role. It can lead to incomplete or misleading information being provided, and still carries the risk of unauthorized disclosure if the partial release is not legally permissible. Professional reasoning. Professionals in health information management should employ a decision-making framework that begins with understanding the request in its entirety. This involves identifying the requester, the specific information sought, and the stated purpose of the request. Next, the ART must consult the relevant regulatory framework and organizational policies to determine the legal and ethical requirements for releasing such information. This includes verifying patient consent, identifying any legal mandates for disclosure, or recognizing situations where disclosure is prohibited. If there is any ambiguity, or if the request falls outside standard procedures, the ART should escalate the matter to a supervisor or the designated privacy officer for guidance. This systematic approach ensures that all decisions are grounded in legal compliance and ethical best practices, protecting both the patient and the organization. Question 7. Compliance review shows that the accredited record technician (ART) is responsible for identifying potential vulnerabilities in the handling of electronic protected health information (EFI) within a U.S.-based healthcare organization. Which of the following approaches best aligns with the ART's role in risk assessment under the Health Insurance Portability and Accountability Act (HIPAA)? Option A. Systematically reviewing access logs to identify any unusual patterns of access, unauthorized disclosures, or instances where EPHI might be exposed to unauthorized individuals. Option B. Primarily relying on patient complaints and staff reports to identify any perceived privacy breaches or security concerns. Option C. Evaluating the total volume of data accessed by departments without investigating the specific nature or purpose of that access. Option D. Focusing on streamlining data retrieval processes for administrative staff, even if it means slightly relaxing access control protocols. The correct answer is A. Systematically reviewing access logs to identify any unusual patterns of access, unauthorized disclosures, or instances where EPHI might be exposed to unauthorized individuals. Explanation: scenario analysis. This scenario presents a professional challenge because the accredited record technician ART is tasked with identifying potential risks to patient privacy and data integrity within a healthcare setting. The ART must balance the need for efficient data access for clinical care with the stringent requirements of HIPAA, Health Insurance Portability and Accountability Act, and other relevant U.S. federal and state privacy laws. The challenge lies in recognizing subtle indicators of noncompliance that might not be immediately obvious and understanding the potential consequences of such breaches. Correct approach analysis. The correct approach involves a proactive and systematic risk assessment process. This aligns with the ART's core responsibilities under HIPAA security rule, which mandates that covered entities conduct regular risk analyses to identify potential vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information (EFI). By focusing on identifying specific areas of potential weakness, such as inadequate access controls or unencrypted data transmission, the ART is directly addressing the regulatory requirement to safeguard patient information and prevent breaches. This approach demonstrates best professional practice by prioritizing patient privacy and data security through diligent identification and mitigation of risks. Incorrect approach is analysis, an approach that focuses solely on the volume of data accessed without considering the context or purpose of access is insufficient. While high access volumes can be a red flag, without further investigation into the legitimacy of that access, it doesn't constitute a comprehensive risk assessment. It fails to meet the regulatory requirement of identifying specific vulnerabilities. An approach that only addresses issues reported by patients or staff is reactive rather than proactive. While patient and staff feedback is valuable, a true risk assessment requires the ART to actively seek out potential risks, not just wait for them to be reported. Relying solely on reported issues could lead to significant breaches occurring before they are identified, violating the spirit and letter of HIPAA security provisions. An approach that prioritizes the ease of data retrieval for administrative purposes over potential privacy concerns is a direct contravention of the ART's ethical and regulatory obligations. The primary duty is to protect patient data, and any process that inherently compromises privacy for convenience is unacceptable and likely violates HIPAA. Professional reasoning. Professionals should approach risk assessment by first understanding the relevant regulatory landscape, e.g., HIPAA, HITECH Act. They should then develop a systematic methodology for identifying potential threats and vulnerabilities to protected health information. This involves reviewing policies and procedures, examining system logs, and assessing physical and technical safeguards. When potential risks are identified, the ART must document them, assess their likelihood and impact, and recommend appropriate mitigation strategies. This iterative process ensures ongoing compliance and the protection of patient data. Question 8. Implementation of a new electronic health record (EHR) system has revealed an alert indicating a potential duplicate entry for a patient's allergy information, entered by two different staff members within minutes of each other. The system flags this as a potential data integrity issue. As an accredited record technician ART, what is the most appropriate immediate course of action? Option A. Ignore the alert, as it is likely a minor system glitch or a common occurrence with new system rollouts, and focus on other immediate tasks. Option B. Confront the staff member who entered the second allergy record directly to understand their actions and instruct them to correct it. Option C. Initiate a documented investigation to determine the accuracy of both entries, consult with the involved staff and their supervisor if necessary, and follow established protocols for merging or correcting the duplicate information, ensuring an audit trail is maintained. Option D. Immediately delete the most recently entered allergy information, assuming it is the duplicate and potentially erroneous entry, to streamline the record. The correct answer is C. Initiate a documented investigation to determine the accuracy of both entries, consult with the involved staff and their supervisor if necessary, and follow established protocols for merging or correcting the duplicate information, ensuring an audit trail is maintained. Explanation. This scenario presents a common ethical dilemma in healthcare information management, specifically concerning the integrity and accessibility of electronic health records, (EHR). The challenge lies in balancing the need for accurate, complete patient records with the potential for human error or intentional misuse of the system. Professionals must navigate these situations with a strong understanding of their ethical obligations and the regulatory framework governing patient data. The correct approach prioritizes patient safety, data integrity, and regulatory compliance. It involves a systematic, documented process for addressing potential errors or unauthorized access, ensuring that any corrections or investigations are handled transparently and in accordance with established protocols. This upholds the principle of accountability and maintains trust in the EHR system. An incorrect approach that involves immediate deletion of potentially erroneous data without proper investigation or documentation violates fundamental principles of record keeping and patient care. It risks obscuring critical information, hindering future clinical decision-making, and failing to meet regulatory requirements for data accuracy and audit trails. Another incorrect approach, such as ignoring the alert due to perceived minor nature, demonstrates a disregard for system integrity and potential patient harm. EHR alerts are designed to flag potential issues, and failing to investigate them can lead to undetected errors or security breaches, which is a direct contravention of professional duty and regulatory mandates. Finally, an approach that involves confronting the individual directly without following established procedures can escalate the situation, compromise any formal investigation, and potentially violate privacy policies. Professional decision-making in such cases requires adherence to established policies and procedures, a commitment to ethical principles, and a thorough understanding of relevant regulations to ensure patient well-being and data security. Question 9. Compliance review shows a critical health information system is experiencing intermittent failures, impacting access to patient records. The IT department is pushing for an immediate restoration of full functionality to minimize disruption to patient care. As an accredited record technician, what is the most appropriate initial step to take? Option A. Implement a temporary workaround to restore basic functionality while deferring a full system analysis until after peak operational hours. Option B. Initiate a comprehensive risk assessment to identify the root cause, potential impacts, and necessary remediation steps before implementing any changes. Option C. Immediately restore the system using the most recent available backup, assuming it will resolve the issue. Option D. Focus solely on restoring system access, assuming data integrity will be maintained through existing system checks. Correct answer is B. Initiate a comprehensive risk assessment to identify the root cause, potential impacts, and necessary remediation steps before implementing any changes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the accredited record technician (ART) to balance the immediate need for system functionality with the long-term implications of data integrity and security. The pressure to restore services quickly can lead to shortcuts that compromise patient safety and regulatory compliance. The ART must exercise sound judgment to ensure that any remediation efforts adhere to established protocols and legal requirements. Correct approach analysis. The correct approach of conducting a thorough risk assessment before implementing any system changes is best professional practice. This aligns with the principles of data governance and information security mandated by relevant healthcare regulations, e.g., HIPAA in the U.S., or equivalent data protection laws in other specified jurisdictions. A risk assessment systematically identifies potential threats and vulnerabilities, evaluates their impact, and prioritizes mitigation strategies. This ensures that the chosen solution not only resolves the immediate issue, but also prevents future occurrences and maintains the confidentiality, integrity, and availability of protected health information. 5. It demonstrates a commitment to patient privacy and regulatory adherence. Incorrect approaches analysis. Implementing a quick fix without a full assessment of potential downstream impacts is a significant regulatory and ethical failure. This approach risks introducing new vulnerabilities, corrupting data, or violating data privacy regulations by not considering the broader system architecture and security implications. It prioritizes expediency over patient safety and data integrity, restoring the system using the most recent backup without verifying its integrity or checking for malware introduces a high risk of reintroducing the problem or compromising data. This bypasses critical security checks and could lead to a breach or data loss, violating the duty to protect patient information and adhere to data backup and recovery standards. Focusing solely on restoring functionality without considering data integrity checks is an ethical lapse. Patient records must be accurate and complete. If the system is restored without verifying the integrity of the data, it could lead to incorrect diagnoses, treatments, or billing, directly impacting patient care and potentially leading to legal repercussions. Professional reasoning. When faced with a health information system disruption, an ART should follow a structured decision-making process. First, acknowledge the urgency but do not let it override due diligence. Second, consult established incident response plans and disaster recovery protocols. Third, initiate a comprehensive risk assessment to understand the root cause, potential impacts, and necessary remediation steps. Fourth, prioritize solutions that ensure data integrity, security, and compliance with all applicable regulations. Finally, document all actions taken and their justifications thoroughly. Question 10. Market research demonstrates that many healthcare providers are struggling to implement robust data governance frameworks that effectively balance patient care coordination with stringent HIPAA and high-tech privacy and security mandates. A new electronic health record (EHR) system is being implemented, which promises enhanced interoperability, but also introduces new pathways for data access and sharing. Which of the following strategies best addresses the implementation challenge of ensuring compliance while facilitating necessary data exchange? Option A. Rely solely on the security features built into the new EHR system without implementing additional organizational policies or staff training. Option B. Implement the new EHR system with minimal changes to existing data sharing protocols, assuming current practices are sufficient for the new technology. Option C. Develop comprehensive data access policies and role-based permissions within the EHR, conduct thorough staff training on HIPAA and high-tech requirements, and establish a regular audit schedule for data access logs. Option D. Grant broad access privileges to all clinical staff within the new EHR system to ensure immediate access to patient information for care coordination purposes. The correct answer is C. Develop comprehensive data access policies and role-based permissions within the EHR, conduct thorough staff training on HIPAA and high-tech requirements, and establish a regular audit schedule for data access logs. Explanation. This scenario presents a common implementation challenge for healthcare organizations striving to comply with HIPAA and high-tech regulations. The core difficulty lies in balancing the need for efficient data sharing to improve patient care with the stringent requirements for protecting protected health information. 5. The rapid evolution of technology and the increasing volume of digital health data exacerbate this challenge, demanding continuous vigilance and adaptation. The correct approach prioritizes a comprehensive, risk-based strategy that integrates regulatory compliance into the fabric of the organization's operations. This involves establishing clear policies and procedures for data access, use, and disclosure, conducting regular risk assessments to identify vulnerabilities, and implementing robust technical and administrative safeguards. Training staff on their responsibilities under HIPAA and high-tech is paramount, as human error is a significant factor in breaches. This approach ensures that the organization not only meets its legal obligations, but also fosters a culture of privacy and security, thereby building patient trust and mitigating the risk of costly penalties and reputational damage. An incorrect approach that focuses solely on technological solutions without addressing policy and training overlooks the human element and the systemic nature of compliance. This can lead to gaps in protection, as technology alone cannot prevent unauthorized access or disclosure if policies are weak or staff are not adequately informed. Another incorrect approach that prioritizes convenience over security by allowing broad access to PHI without proper authorization or audit trails directly violates HIPAA privacy and security rules. This creates significant vulnerabilities for breaches and unauthorized disclosures, leading to potential fines and legal repercussions. Finally, an approach that neglects regular updates to policies and training in response to evolving threats and regulatory guidance fails to maintain compliance in a dynamic environment. This reactive stance makes the organization susceptible to new risks and can result in noncompliance with updated high-tech provisions or new interpretations of HIPAA. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements. HIPAA. High-tech. This involves identifying all PHI that the organization handles, assessing the risks associated with its storage, transmission, and use, and then developing layered safeguards, technical, physical, administrative. Regular audits, incident response planning, and ongoing staff education are crucial components of this framework. The process should be iterative, with continuous evaluation and improvement based on risk assessments and monitoring of compliance activities. Question 11. Stakeholder feedback indicates that the upcoming implementation of new ICD codes is causing significant anxiety among coding staff due to the complexity and volume of changes. As an art, what is the most appropriate strategy to ensure accurate and compliant coding while mitigating staff stress and potential errors? Option A. Mandate immediate adoption of all new ICD codes by all staff, providing only brief, ad hoc Q and A sessions to address immediate concerns. Option B. Delay the implementation of the new ICD codes until staff express readiness, relying on informal peer-to-peer knowledge sharing for updates. Option C. Implement a comprehensive multi-stage training program for all coding staff, followed by a phased rollout of the new ICD codes with ongoing support and quality assurance checks. Option D. Provide a single, comprehensive training session covering all new ICD codes, expecting immediate full compliance from all staff without further support. The correct answer is C. Implement a comprehensive, multi-stage training program for all coding staff, followed by a phased rollout of the new ICD codes with ongoing support and quality assurance checks. Explanation. This scenario is professionally challenging because it requires balancing the need for accurate and compliant coding with the practical realities of a busy healthcare environment and the varying levels of expertise among staff. The accredited record technician, ART, must ensure that the implementation of ICD updates does not compromise patient care or lead to regulatory noncompliance. Careful judgment is required to select an approach that is both effective and sustainable. The correct approach represents best professional practice because it prioritizes comprehensive training and phased implementation. This ensures that all relevant personnel understand the nuances of the new ICD codes and can apply them accurately. It also allows for a controlled rollout, minimizing the risk of widespread errors and providing opportunities for feedback and adjustment. This aligns with the ethical obligation to maintain accurate patient records and the regulatory requirement to adhere to coding standards, which are fundamental to proper reimbursement and data integrity. An incorrect approach that focuses solely on immediate, mandatory compliance without adequate training risks significant coding errors. This can lead to inaccurate data, improper billing, and potential regulatory penalties for noncompliance with coding guidelines. Another incorrect approach that relies on self-training or informal knowledge sharing is professionally unacceptable because it creates an inconsistent and unreliable coding environment. This can result in disparities in coding accuracy across different departments or individuals, undermining the integrity of the entire health record system and potentially violating the principle of due diligence in maintaining professional standards. A third incorrect approach that delays implementation indefinitely due to perceived complexity, without a clear plan for eventual adoption, fails to meet the ongoing regulatory obligation to use the most current coding systems, thereby compromising the accuracy and comparability of health data over time. Professionals should approach such situations by first assessing the scope of the ICD update and its potential impact. This should be followed by developing a structured training plan tailored to the needs of different staff roles. A phased implementation strategy, coupled with robust quality assurance mechanisms and clear channels for feedback, is crucial for successful adoption. Continuous monitoring and ongoing education are also vital to ensure sustained compliance and accuracy. Question 12. Investigation of a patient's medical record reveals a complex presentation of symptoms that could be interpreted under multiple diagnostic codes within the applicable clinical classification system. The accredited record technician ART is tasked with assigning the most accurate code. Which of the following actions best aligns with regulatory compliance and professional best practice for an ART? Option A. Choose the code that best reflects the patient's primary complaint, even if other documented conditions are more severe. Option B. Utilize a coding software's automated suggestion without independent verification, trusting its algorithm to be accurate. Option C. Assign the code that is most frequently used for similar symptom presentations, assuming it is likely correct. Option D. Consult the official coding manual and its latest addenda, and if ambiguity persists, seek clarification from a clinical supervisor or coding expert. The correct answer is C. Assign the code that is most frequently used for similar symptom presentations, assuming it is likely correct. Explanation. This scenario is professionally challenging because it requires the accredited record technician, ART, to balance the need for accurate clinical classification with the potential for misinterpretation or misuse of coded data. The ART must understand the nuances of clinical classification systems and their application within the specific regulatory framework governing healthcare records. Careful judgment is required to ensure that the chosen classification accurately reflects the patient's condition and treatment, while adhering to all applicable laws and guidelines. The correct approach represents best professional practice because it prioritizes accuracy and adherence to the established coding guidelines and regulatory requirements. By consulting official coding manuals and seeking clarification from appropriate sources when uncertain, the ART ensures that the classification is both clinically sound and compliant. This upholds the integrity of patient records and supports accurate data analysis for quality improvement, research, and billing, all within the defined regulatory boundaries for ARTs. An incorrect approach that relies solely on personal interpretation or a superficial understanding of the patient's condition fails to meet the professional standards expected of an ART. This can lead to inaccurate data, which has downstream consequences for patient care, research validity, and financial reporting. Such an approach may violate regulatory requirements for accurate record-keeping and coding, potentially leading to compliance issues. Another incorrect approach that involves using outdated or unofficial coding resources is also professionally unacceptable. Regulatory frameworks often mandate the use of current, official coding systems and guidelines. Failure to comply with these mandates can result in significant penalties and compromises the reliability of the health information. Finally, an approach that bypasses established protocols for clarification or peer review when encountering complex cases demonstrates a lack of diligence and a disregard for the collaborative nature of accurate record management. This can lead to persistent errors and a failure to maintain the high standards of data integrity required by the profession and its governing regulations. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review the patient's clinical documentation to understand the full clinical picture. Second, consult the most current and official version of the relevant clinical classification system and its accompanying guidelines. Third, if ambiguity or complexity exists, actively seek clarification from supervisors, coding experts, or relevant clinical staff, documenting all such consultations. Fourth, ensure the final classification is defensible based on the documentation and established coding principles, always within the bounds of the ART's regulatory jurisdiction. Question 13. What factors determine the appropriate implementation strategy for emerging technologies aimed at optimizing health information management processes, ensuring both efficiency gains and adherence to regulatory frameworks? Option A. The availability of the technology in the market and its general popularity among other healthcare organizations. Option B. A comprehensive assessment of the technology's impact on data security, privacy, accuracy, and its alignment with existing workflows and regulatory requirements. Option C. The marketing claims made by technology vendors and the ease of adoption without independent validation or risk analysis. Option D. The perceived cost savings and the speed at which the technology can be deployed, regardless of its integration capabilities or potential risks. The correct answer is B. A comprehensive assessment of the technology's impact on data security, privacy, accuracy, and its alignment with existing workflows and regulatory requirements. Explanation. This scenario is professionally challenging because the rapid evolution of emerging technologies in health information management (HIM) requires professionals to constantly adapt and evaluate new tools for process optimization without compromising patient privacy, data integrity, or regulatory compliance. The core challenge lies in balancing the potential efficiency gains of new technologies with the stringent legal and ethical obligations inherent in managing protected health information. 5. Careful judgment is required to discern which technologies genuinely enhance HIM processes and which pose undue risks. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation that aligns with established HIM principles and regulatory mandates. This involves a thorough assessment of how a technology integrates with existing workflows, its impact on data security and privacy, its ability to maintain data accuracy and completeness, and its compliance with relevant regulations such as HIPAA, Health Insurance Portability and Accountability Act. In the U.S. context, this approach ensures that process optimization efforts are not only efficient but also ethically sound and legally defensible, safeguarding patient rights and organizational integrity. An incorrect approach that focuses solely on the perceived speed or cost-saving benefits of a new technology without a comprehensive risk assessment is professionally unacceptable. This failure constitutes a significant regulatory and ethical lapse because it bypasses critical due diligence required by HIPAA privacy and security rules. Specifically, it neglects the obligation to conduct a thorough risk analysis to identify and mitigate potential vulnerabilities that could lead to unauthorized access, use, or disclosure of PHI. Such an oversight can result in severe penalties, including fines, corrective action plans, and reputational damage. Another incorrect approach that involves implementing a new technology based on vendor claims alone, without independent validation or pilot testing, is also professionally unsound. This approach risks introducing unproven or incompatible systems that could disrupt existing processes, compromise data integrity, or create new security loopholes. Ethically, it violates the principle of due diligence and responsible stewardship of patient data. From a regulatory standpoint, it fails to demonstrate a proactive commitment to ensuring the security and privacy of PHI, which is a cornerstone of HIPAA compliance. A professional decision-making process for similar situations should involve a structured evaluation framework. This framework should include 1. Defining the specific process to be optimized. 2. Identifying potential technological solutions. 3. Conducting a thorough risk assessment for each solution, considering privacy, security, and integrity implications. 4. Evaluating technical feasibility and integration capabilities. 5. Assessing regulatory compliance. 6. Performing pilot testing and user feedback. And 7. Documenting the entire evaluation and decision-making process. This systematic approach ensures that technology adoption is strategic, secure, and compliant. Question 14. When evaluating the implementation of a new electronic health record (EHR) system, what is the most critical initial step an accredited record technician (ART) must undertake to ensure compliance with health information privacy and security regulations? Option A. Rely solely on the EHR vendor's pre-implementation security audit report to validate system compliance. Option B. Begin user training on the new EHR system immediately to facilitate rapid adoption and minimize disruption. Option C. Conduct a comprehensive risk assessment to identify potential vulnerabilities and threats to protected health information within the new EHR system and its integration points. Option D. Prioritize system performance testing to ensure the EHR operates efficiently and meets clinical workflow demands. Correct answer is C. Conduct a comprehensive risk assessment to identify potential vulnerabilities and threats to protected health information within the new EHR system and its integration points. Explanation. This scenario is professionally challenging because the accredited record technician (ART) must balance the imperative of maintaining patient privacy and data security with the operational need to implement new health information technology (HIT). The rapid evolution of HIT presents both opportunities for improved patient care and risks of data breaches or non-compliance with regulations. The ART's role requires a proactive and thorough risk assessment to identify potential vulnerabilities before they can be exploited or lead to regulatory violations. The correct approach involves conducting a comprehensive risk assessment that specifically addresses the potential impact of the new HIT system on patient data confidentiality, integrity, and availability. This aligns with the fundamental principles of health information management and regulatory frameworks such as HIPAA, Health Insurance Portability and Accountability Act. In the U.S., which mandates risk analysis as a cornerstone of security and privacy programs, A thorough assessment allows for the identification of specific threats and vulnerabilities, enabling the implementation of appropriate safeguards to mitigate these risks. This proactive stance ensures compliance and protects patient trust. An incorrect approach would be to proceed with the HIT implementation without a formal risk assessment, assuming the vendor's security measures are sufficient. This fails to acknowledge the ART's responsibility to independently verify and ensure compliance with applicable regulations. It represents a significant regulatory failure, as HIPAA and similar regulations require covered entities to conduct their own risk analyses. Ethically, it demonstrates a lack of due diligence in protecting patient information. Another incorrect approach is to focus solely on the technical aspects of the HIT system, such as system performance and interoperability, while neglecting the privacy and security implications. This overlooks the core responsibilities of an ART, which extend beyond technical functionality to encompass the safeguarding of protected health information. 5. This approach risks noncompliance with privacy rules and could lead to breaches of confidentiality, a critical ethical and regulatory failure. A third incorrect approach would be to delegate the entire risk assessment process to the HIT vendor without independent oversight or validation. While vendor expertise is valuable, the ultimate responsibility for compliance rests with the healthcare organization and its ART. Relying solely on the vendor's assessment creates a blind spot and fails to account for the organization's specific workflows, data handling practices, and unique risk profile. This is a failure to exercise professional judgment and a potential regulatory pitfall. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the regulatory landscape. Identify all applicable laws and regulations governing health information. 2. Define the scope. Clearly delineate what aspects of the HIT implementation will be assessed. 3. Identify assets. Catalog all sensitive data and systems that will be affected. 4. Identify threats and vulnerabilities. Brainstorm potential risks to data security and privacy. 5. Analyze impact and likelihood. Evaluate the potential consequences and probability of each risk occurring. 6. Determine mitigation strategies. Develop and implement controls to reduce identified risks. 7. Document and review. Maintain thorough records of the assessment and regularly update it. Question 15. Benchmark analysis indicates that accurately assigning current procedural terminology, CPT codes for surgical procedures, requires careful consideration of the operative report's details. When a surgeon performs a primary procedure and also documents a distinct, separately identifiable service that is not integral to the primary procedure, how should an accredited record technician, ART, approach the coding? Option A. Sign the CPT code for the primary procedure and assume the additional service is included in its payment. Option B. Assign the CPT code for the primary procedure and a separate CPT code for the distinct, separately identifiable service, ensuring appropriate documentation supports both. Option C. Assign the CPT code for the primary procedure and append a modifier to indicate the additional service was performed. Option D. Assign the CPT code for the primary procedure and consult a colleague for their opinion on how to code the additional service. The correct answer is C. Assign the CPT code for the primary procedure and append a modifier to indicate the additional service was performed. Explanation. This scenario is professionally challenging because accurately assigning current procedural terminology, CPT codes, requires a nuanced understanding of both the physician's documentation and the specific guidelines within the CPT manual. Misinterpreting the documentation or applying the wrong coding principles can lead to significant financial and compliance issues for the healthcare provider. The ART must act as a crucial intermediary, ensuring that the codes accurately reflect the services rendered, which directly impacts billing, reimbursement, and statistical reporting. The correct approach represents best professional practice because it prioritizes a thorough review of the operative report and adherence to CPT coding guidelines. This ensures that the most specific and appropriate code is selected, reflecting the complexity and nature of the procedure performed. This aligns with the fundamental principle of accurate medical record documentation and coding, which is essential for regulatory compliance and fair reimbursement. An incorrect approach that focuses solely on the primary procedure without considering any additional services or complexities documented would be a regulatory failure. This could lead to undercoding, resulting in lost revenue for the provider and potentially inaccurate statistical data. Conversely, an approach that bundles services inappropriately or assigns codes for services not explicitly documented would be a compliance failure, potentially leading to overcoding and accusations of fraud or abuse. Another incorrect approach might involve relying on external, non-official coding resources without cross-referencing the official CPT manual, which is a failure to adhere to the authoritative source of coding information. Professionals should employ a systematic decision-making process. First, thoroughly read and understand the physician's documentation, identifying all services performed. Second, consult the official CPT manual, using the index and tabular list to locate potential codes. Third, carefully review the guidelines, parenthetical notes, and any applicable if/then statements associated with the potential codes. Fourth, consider any modifiers that may be necessary to accurately describe the service. Finally, select the most specific and appropriate code that accurately reflects the documented service, ensuring compliance with all relevant coding principles and regulations. Question 16. The performance metrics show a significant increase in patient data access requests, prompting a review of current record retrieval protocols. An ART is tasked with identifying research methodologies that could inform improvements to these protocols, ensuring both efficiency and data security. Which of the following research approaches would best support evidence-based decision-making for this scenario? Adhering to the principles of health information management. Option A. A single, anecdotal case study from a non-healthcare industry detailing a successful data retrieval system implementation. Option B. A review of popular technology blogs discussing the latest trends in data management, regardless of their applicability to healthcare or regulatory compliance. Option C. An exploratory qualitative study interviewing IT support staff about their general frustrations with the current system, without specific reference to patient data access. Option D. A systematic review and meta-analysis of studies examining the impact of different indexing and retrieval algorithms on electronic health record access times and error rates, with a specific focus on studies conducted within regulated healthcare environments. The correct answer is D. A systematic review and meta-analysis of studies examining the impact of different indexing and retrieval algorithms on electronic health record access times and error rates, with a specific focus on studies conducted within regulated healthcare environments. Explanation. This scenario is professionally challenging because it requires the accredited record technician art to critically evaluate the quality and relevance of research methodologies used to inform health information practices, particularly concerning patient data privacy and security. The ART must balance the need for evidence-based decision-making with the stringent regulatory requirements governing health records. The correct approach represents best professional practice because it prioritizes a systematic and critical evaluation of research methodologies. This involves assessing the study design, data collection methods, statistical analysis, and the generalizability of findings within the specific context of health information management. Adhering to established research principles ensures that any changes or implementations based on the research are robust, reliable, and ethically sound, thereby upholding patient confidentiality and data integrity as mandated by relevant health information regulations. This approach aligns with the professional responsibility to ensure that health information systems and practices are informed by credible and appropriate evidence. An incorrect approach that relies solely on the perceived novelty or popularity of a research methodology fails to meet professional standards. This is because novelty does not equate to validity or applicability in the regulated field of health information. Such an approach risks implementing practices based on flawed or irrelevant research, potentially leading to breaches of patient privacy, data inaccuracies, or non-compliance with health information laws. Another incorrect approach, which prioritizes research that is easily accessible or quickly published without rigorous peer review, also presents significant ethical and regulatory failures. This bypasses the essential quality control mechanisms that ensure research is scientifically sound and trustworthy. Implementing practices based on such research could result in significant data security vulnerabilities or misinterpretations of patient health information, directly contravening the duty of care and legal obligations of an ART. Professionals should employ a decision-making framework that begins with clearly defining the problem or objective. Next, they should identify potential research methodologies that could address this objective. Crucially, each methodology must be critically evaluated for its rigor, validity, ethical considerations, and relevance to the specific health information context and regulatory environment. This involves considering the study's design, sample size, data analysis techniques, and potential biases. The ART should then select the methodology that offers the most reliable and appropriate evidence, ensuring it aligns with all applicable laws and ethical guidelines governing health information. Question 17. Compliance review shows that a new physician is frequently entering patient diagnoses using free text descriptions that are not aligned with the established standardized terminologies and coding systems used within the electronic health record (EHR) system. The ART is tasked with addressing this data entry issue to ensure the health data structure and content meet regulatory requirements. Option A. Inform the physician that their current data entry method is unacceptable and suggest they manually cross-reference their free text notes with standardized codes after each patient encounter. Option B. Implement a mandatory training program for all physicians on the correct use of standardized terminologies and coding systems for all data entry, and establish a process for regular audits to ensure compliance with data structure and content standards. Option C. Advise the physician to continue using free text descriptions, as it allows for more detailed and personalized patient information, and document this deviation in the patient's record. Option D. Create custom data fields within the EHR to accommodate the physician's preferred free text descriptions, ensuring that these new fields are clearly labeled. The correct answer is B. Implement a mandatory training program for all physicians on the correct use of standardized terminologies and coding systems for all data entry, and establish a process for regular audits to ensure compliance with data structure and content standards. Explanation. This scenario is professionally challenging because it requires the accredited record technician art to balance the need for accurate and complete health data with the strict adherence to established data structure, content, and standards, specifically within the U.S. regulatory framework governing health information. The ART must understand that deviations from these standards, even with good intentions, can compromise data integrity, interoperability, and compliance with regulations like HIPAA. The correct approach represents best professional practice because it prioritizes maintaining the integrity and standardization of health data as mandated by U.S. healthcare regulations. Adhering to established data structures and content standards ensures that patient information is recorded consistently, facilitating accurate clinical decision-making, efficient data exchange between healthcare providers, and compliance with legal and regulatory requirements. This approach upholds the principles of data quality and security essential for patient care and privacy. An incorrect approach that involves creating custom data fields without proper validation or adherence to existing standards fails to meet regulatory requirements. This can lead to data fragmentation, making it difficult to aggregate information for research, public health initiatives, or quality improvement efforts. It also poses a significant risk to patient privacy and data security, as custom fields may not incorporate the necessary safeguards mandated by HIPAA. Furthermore, such deviations hinder interoperability, preventing seamless data sharing with other healthcare systems that rely on standardized formats. Another incorrect approach, such as prioritizing speed over data accuracy and completeness, directly violates the core responsibilities of an ART. Inaccurate or incomplete health records can lead to misdiagnoses, inappropriate treatments, and potential patient harm. This also undermines the reliability of the health record for legal and administrative purposes, creating significant compliance risks. Finally, an approach that ignores established content standards in favor of subjective interpretations of patient information introduces ambiguity and inconsistency into the health record. This compromises the objective nature of health data and can lead to miscommunication among healthcare professionals, impacting patient safety and the overall quality of care. The professional decision-making process for similar situations should involve a thorough understanding of applicable U.S. regulations, e.g., HIPAA, HITECH Act, and industry-specific data standards, e.g., HL7, SNOMED-CT. When faced with a situation requiring data management, the ART should first consult relevant documentation and guidelines. If a deviation or new requirement arises, the ART must assess its impact on data integrity, interoperability, and regulatory compliance. Seeking clarification from supervisors or relevant compliance officers is crucial before implementing any changes that deviate from established standards. The ultimate goal is to ensure that all health data is accurate, complete, standardized, and secure, thereby supporting optimal patient care and meeting all legal and ethical obligations. Question 18. Cost-benefit analysis shows that implementing a new encryption protocol for electronic protected health information, EFI, would significantly reduce the risk of data breaches, but the initial investment is substantial. The organization is considering several options for enhancing its security posture. Which approach best aligns with regulatory requirements for protecting health information? Option A. Prioritize the encryption solution with the lowest upfront licensing cost, assuming that any encryption is better than no encryption, without a detailed analysis of its effectiveness or compatibility with existing systems. Option B. Implement the most advanced and feature-rich encryption protocol available, regardless of its complexity or the organization's current technical capabilities, to ensure the highest level of protection. Option C. Defer the encryption upgrade indefinitely, citing the high upfront cost, and rely on existing, less robust security measures until a more budget-friendly solution becomes available. Option D. Conduct a comprehensive risk assessment to identify specific vulnerabilities and threats to EPHI, then select encryption solutions that are appropriate to the organization's size, complexity, and the nature of its EPHI, prioritizing those that offer the best balance of security and manageability. Correct answer is D. Conduct a comprehensive risk assessment to identify specific vulnerabilities and threats to EPHI, then select encryption solutions that are appropriate to the organization's size, complexity, and the nature of its EPHI, prioritizing those that offer the best balance of security and manageability. Explanation. Scenario analysis. This scenario presents a common challenge in health information management, balancing the need for robust security and privacy measures with the operational and financial realities of implementing them. The professional is tasked with evaluating a proposed technological solution, requiring a nuanced understanding of both the technical implications and the legal/regulatory landscape governing health information. The challenge lies in identifying a solution that is not only effective, but also compliant and justifiable from a cost-benefit perspective, ensuring patient data is protected without unduly burdening the organization. Correct approach analysis. The correct approach prioritizes a comprehensive risk assessment aligned with the Health Insurance Portability and Accountability Act, HIPAA, security rule. This rule mandates that covered entities implement administrative, physical, and technical safeguards to protect electronic protected health information, EFI. A thorough risk assessment identifies vulnerabilities and threats, allowing for the selection of security measures that are appropriate to the organization's size, complexity, and the nature of its EPHI. This approach ensures that investments are targeted towards the most critical risks, demonstrating due diligence and compliance with HIPAA requirement for a risk analysis and management program. It also aligns with the ethical obligation to safeguard patient privacy. Incorrect approaches analysis. One incorrect approach might focus solely on the lowest upfront cost without considering the long-term security implications or potential breach costs. This fails to meet HIPAA requirement for a comprehensive risk analysis and management program, as it neglects to assess the likelihood and impact of security incidents. Such an approach could lead to inadequate protection of EPHI, resulting in significant financial penalties, reputational damage, and loss of patient trust if a breach occurs. Another incorrect approach might involve implementing a solution that offers advanced security features, but is overly complex for the organization's staff to manage effectively. This could lead to misconfigurations or user errors, creating vulnerabilities that undermine the intended security. While seemingly robust, this approach fails to meet the reasonable and appropriate standard of the HIPAA security rule, as it doesn't consider the practical implementation and ongoing management of the safeguards. A third incorrect approach might be to defer security upgrades indefinitely, citing budget constraints without a formal risk assessment to justify the delay. This directly contravenes HIPAA mandate to implement security measures to protect EPHI. The absence of a documented risk analysis and management plan, coupled with a failure to implement necessary safeguards, leaves the organization exposed to significant legal and financial repercussions in the event of a security incident. Professional reasoning. Professionals should approach such decisions by first understanding the specific regulatory requirements applicable to their jurisdiction, in this case, HIPAA for the U.S. This involves conducting a thorough risk assessment to identify potential threats and vulnerabilities to protected health information. Following the risk assessment, a cost-benefit analysis should be performed, considering not only the direct costs of implementing security measures, but also the potential costs of a data breach, fines, legal fees, remediation, reputational damage. The chosen solution should be the most effective in mitigating identified risks while being feasible for the organization to implement and maintain, ensuring ongoing compliance and the protection of patient privacy. Question 19. The monitoring system demonstrates an unusual pattern of access to a specific patient's electronic health record, indicating a potential unauthorized viewing. As an accredited record technician, ART, you are the first to notice this anomaly. What is the most appropriate course of action to ensure regulatory compliance and maintain the integrity of patient records? Option A. Attempt to investigate the anomaly yourself to understand the scope of the issue before reporting it. Option B. Ignore the anomaly, assuming it might be a system glitch that will resolve itself. Option C. Immediately report the anomaly through the facility's established incident reporting system to the designated compliance officer or supervisor. Option D. Discuss the observed anomaly with a trusted colleague to get their opinion on how to proceed. The correct answer is C. Immediately report the anomaly through the facility's established incident reporting system to the designated compliance officer or supervisor. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for operational efficiency with the long-term imperative of maintaining regulatory compliance and patient privacy. The accredited record technician, ART, is in a position where a perceived shortcut could lead to significant ethical and legal repercussions, impacting patient trust and the accreditation status of the healthcare facility. Careful judgment is required to navigate the tension between expediency and adherence to established protocols. The correct approach represents best professional practice because it prioritizes patient confidentiality and data integrity, which are foundational principles for ARTs and are heavily regulated. By immediately reporting the observed anomaly through the established channels, the ART upholds the facility's commitment to regulatory compliance, such as HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which mandates strict controls over protected health information. 5. This action demonstrates a proactive commitment to identifying and rectifying potential breaches before they escalate, thereby safeguarding patient rights and the facility's accreditation. It aligns with the ethical duty of an ART to act with integrity and to protect sensitive information. An incorrect approach that involves ignoring the anomaly or attempting to fix it without proper authorization and documentation would constitute a significant regulatory and ethical failure. Ignoring the issue could lead to a continued violation of privacy regulations, potentially exposing patient data to unauthorized access. Attempting to fix it independently without following established protocols bypasses necessary oversight and audit trails, which are crucial for demonstrating compliance. This could be interpreted as a deliberate attempt to conceal a problem, which is a severe breach of professional conduct and could jeopardize the facility's accreditation. Furthermore, such actions undermine the trust placed in ARTs to manage health records responsibly. Another incorrect approach, such as discussing the anomaly with colleagues outside of the designated reporting structure, would also be a regulatory and ethical failure. This informal dissemination of information, even with good intentions, could lead to gossip, speculation, and a breach of confidentiality. It bypasses the formal incident reporting mechanism, which is designed to ensure that issues are addressed systematically, investigated thoroughly, and resolved appropriately, with all actions documented for compliance purposes. This approach fails to respect the privacy of the individual whose records might be affected, and disregards the established procedures for managing sensitive information. The professional decision-making process for similar situations should involve a clear understanding of the facility's policies and procedures for reporting data anomalies and potential security incidents. ARTs should be trained to recognize what constitutes a potential breach or violation of regulations. The first step should always be to consult the relevant policies, and then to follow the prescribed reporting channels, which typically involve notifying a supervisor or a designated compliance officer. This ensures that the issue is handled by those with the authority and expertise to investigate and rectify it, while maintaining an accurate record of the incident and its resolution. Prioritizing transparency, adherence to protocol, and the protection of patient data are paramount. Question 20. System analysis indicates that a healthcare organization is seeking to understand patient readmission rates across different demographic groups and treatment protocols to inform resource allocation and intervention strategies. As an accredited record technician, ART, which data analysis approach would best support these objectives while adhering to regulatory frameworks governing health records? Option A. Segmenting patient data by key demographic factors, age, gender, primary diagnosis, and treatment protocol types, then analyzing readmission trends within these segments to identify specific high-risk groups and the effectiveness of different interventions. Option B. Prioritizing the fastest possible generation of a summary report on readmission rates, even if it means simplifying the data and omitting detailed segmentation or nuanced trend analysis to meet an immediate deadline. Option C. Focusing solely on identifying the largest patient cohorts by volume and analyzing their readmission rates, disregarding smaller but potentially high-risk subpopulations or specific treatment outcomes. Option D. Aggregating all patient readmission data into a single large dataset and performing a broad trend analysis to identify overall patterns without considering specific patient characteristics or treatment variations. The correct answer is A. Segmenting patient data by key demographic factors, age, gender, primary diagnosis, and treatment protocol types, then analyzing readmission trends within these segments to identify specific high-risk groups and the effectiveness of different interventions. Explanation. This scenario presents a professional challenge because the accredited record technician, ART, must interpret complex data to inform strategic decisions for a healthcare organization, balancing the need for actionable insights with the strict requirements of data privacy and security. The ART's role requires not just technical proficiency in data analysis, but also a deep understanding of the regulatory landscape governing health records. The correct approach represents best professional practice because it prioritizes a systematic, multifaceted analysis that directly addresses the stakeholders' needs while adhering to regulatory mandates. This involves segmenting data based on relevant clinical and operational factors, identifying trends and anomalies, and then presenting these findings in a clear, actionable format. This aligns with the principles of data integrity and responsible data stewardship expected of an ART, ensuring that insights are derived ethically and are useful for improving patient care and operational efficiency. The ART must ensure that any analysis performed does not inadvertently breach patient confidentiality, a core tenet of health record management. An incorrect approach that focuses solely on identifying the largest patient cohorts without considering the clinical context or potential for bias would be professionally unacceptable. This fails to provide the nuanced insights stakeholders require and risks misinterpreting data, leading to flawed strategic decisions. It also overlooks the ethical obligation to analyze data in a way that respects the complexity of patient populations and avoids oversimplification. Another incorrect approach that involves aggregating all patient data into a single, undifferentiated dataset for analysis would be a significant regulatory failure. This approach would likely obscure critical trends and variations within specific patient groups, rendering the analysis less valuable. More importantly, it could lead to the unintentional disclosure of sensitive information if not handled with extreme care, potentially violating patient privacy regulations. The ART has a duty to protect patient data and ensure its analysis is conducted in a manner that maintains confidentiality. A third incorrect approach that prioritizes speed of analysis over accuracy and completeness would also be professionally unacceptable. In the realm of healthcare records, even minor inaccuracies can have significant consequences for patient care and organizational compliance. The ART must ensure that the data analysis is thorough, validated, and presented with appropriate caveats, reflecting the inherent uncertainties in any data interpretation. This commitment to accuracy is a fundamental ethical and professional responsibility. The professional reasoning process for an ART in such a situation should involve 1. Clearly defining the stakeholders' objectives and the specific questions they seek to answer with the data. 2. Identifying the relevant data sources and assessing their quality and completeness. 3. Selecting appropriate data analysis techniques that are both robust and compliant with all applicable regulations, particularly those related to patient privacy and data security. 4. Performing the analysis, ensuring that data segmentation and interpretation are clinically and operationally relevant. 5. Validating the findings and identifying any limitations or potential biases. 6. Communicating the results clearly and concisely to stakeholders, providing actionable insights while maintaining data confidentiality. 7. Documenting the entire process, including the methodologies used and the rationale for decisions made.